Hello, everybody. I am Dr. Zubin Sharma, and I am a senior consultant at gastroenterology and endoscopy. And today I'll talk about a very interesting topic to all of you. I think it's relevant to everybody today, and there's not enough information that is available on this topic. I'm going to talk about endoscopic methods for weight loss. See, we have all seen, and nowadays is very much in news about the drugs, the medicines, the injections which are available for weight loss. That is Ozempic and Manjaro, Rybelsus, Wegovy. And we have always heard of bariatric surgery. That means surgery for weight loss. So there is a lacuna in between for patients who cannot tolerate the medications or cannot afford the medications for life now versus for patients who are not willing to undergo a major risky surgical procedure. Is there something in between for them which is safer, done endoscopically without any kind of cuts on the abdomen, and is does it give you a sustained weight loss? So yes, there are methods available for it, and today we will talk of the endoscopic methods for weight loss. See, there are broadly three or four different kinds of methods which we commonly do for inducing weight loss, for maintaining weight loss in patients who need them. The most important and the most commonly that we use is something called as an endoscopic balloon placement. These are different kinds of balloons which are placed completely endoscopically while the patient is under sedation. While he's sleeping, we do endoscopy like any endoscopy from the mouth. They will not feel any pain. When we go in, we place a small balloon inside the stomach. There are various kinds of balloons, something like a Orbera balloon or a Spax balloon, and these balloons are then inflated with fluid. What will they do is that they will occupy a lot of space in the stomach. Once they occupy that lot of space in the stomach, automatically the need of food or the amount of food that a patient can eat, that comes down. And these balloons are usually kept anywhere between 6 months to a year. And over 6 months to a year, it leads to a lot of weight loss, almost to the tune of 15 to 20% of total body weight. These balloons are then removed similarly by doing endoscopy. So it's practically a without cut procedure. So endoscopic balloon placement is something which is very easily available, and we do it routinely for our patients who need weight loss and cannot afford medications or cannot undergo major surgeries. Second method is nowadays what we call as an endoscopic sleeve gastroplasty, ESG. So now earlier there used to be a laparoscopic surgery, laparoscopic sleeve gastroplasty to remove a part of your stomach. Again, it works on the same principle by reducing the volume of your stomach so you can automatically eat less. With endoscopic sleeve gastroplasty, what we do is we again going endoscopically, we take sutures inside the stomach rather than from the outside, and we reduce the capacity of your stomach. Once we reduce the capacity of your stomach, automatically the amount of food that a patient can eat, it comes down, and over a period of time, weight loss happens. So these two are principal methods of inducing weight loss. There are other methods also like banding or ablation, but then these two are the ones which are most commonly done. Now, who are the patients who can actually undergo these methods? Patients, as I said, who are not willing or cannot tolerate medications or cannot undergo surgery because of major risk factors can easily undergo these endoscopic methods. Your BMI should be above 30 along with some comorbidities like diabetes, hypertension, heart problems, or BMI above 35 are patients who can undergo bariatric endoscopic methods like the one I talked about. Some of them are reversible, like the balloon is reversible. You take out the balloon and it is done. And the ESG is a permanent procedure. Also, we have to understand certain side effects. So, balloon patients usually have temporary side effects, that is, within the first week. As they tolerate that balloon inside the stomach, they may feel some nausea and vomiting, which is managed by medications. There are also balloons which are now swallowed up directly and they don't require endoscopy, also, something called as an aileron balloons. whereas some balloons will require an endoscopic placement. In ESD patients, again, in the first few weeks, you will have some, bloating because of you had done a suturing and you reduced the space, and some nausea and vomiting, which is managed with medications. Serious complications are relatively rare. They can happen in 1 to 2% of patients who undergo these procedures, but they are usually sustained. So these are the methods which are done endoscopically to induce weight loss, and it is easily available in a lot of centers. So if you have any patient or you yourself want to know more about endoscopic methods of weight loss, feel free to contact us on the given number. We'll definitely answer you back. Thank you so much.